Hi, I'm Dr. Richard Brownlee. I'm a neurosurgeon and I work at the Welcome Back MRI and Pain Management Center in Kamloops. Today we're going to talk about sciatica. So what is sciatica? Sciatica means leg pain. People that get pain basically that runs from their back down their leg describe it as being sciatica. And it's because it follows the distribution of the sciatic nerve. And the most common cause of sciatica is what's called a disc herniation. So the discs in the spine are positioned between each of the vertebrae in the back. And they have two components. One is called the annulus, which is the outer part of the disc, and the central part of the disc is called the nucleus. So people consider discs to be like jelly donuts. So when people get a disc herniation, it's like squirting some of the jelly from the middle of the donut out into the spinal canal. And then that jelly material is very irritating to the nerve, and then people get pain down their leg. And the distribution of your leg pain depends on which nerve is affected. So this diagram here just shows that if it's an L3 nerve, which is the disc between the third and fourth vertebrae, people can get pain that radiates down their leg, usually just to the knee. Or if people have a disc herniation between the fourth and fifth vertebrae, they get the L5 nerve is affected, and people will get pain that runs down the outside of their leg down to their foot. And most of their pain is usually on the side of their ankle, and they can get numbness on the side of their ankle and the top of their foot. And then the S1 nerve root, people get pain in their butt, down the back of their thigh and into their calf, and then often will get numbness on the side of their foot. So again, depending on which disc is involved will determine which nerve gets pinched, and that in turn will determine where in your leg you get your pain. So I'm just going to show you another diagram here that shows what a disc herniation looks like. Okay, so when you think of your spine in cross section, so this is a spine, the vertebrae and the discs are actually in the front of the spine. You have arches of bone at the back called spinous processes and lamina, and then all the nerves are in this tube that runs down the middle of that. So when people get a disc herniation, the disc basically ruptures so that the nuclear material protrudes backwards into the spinal canal. That's what this little thing is showing. And on this picture here, this is the disc in the front of the spine. This is a disc herniation. This is the tube that has all the nerves in it. So this nerve is being pinched, and then people will develop pain down their leg in the distribution of that particular nerve. Fortunately, most people with disc herniations get better regardless of what kind of treatment you have. Probably 80 or 90% of people get better. Most people get better within 3 months. If you don't get better, doing things like cortisone shots sometimes can be helpful, and if that doesn't get rid of your pain, doing surgery to remove this piece of disc material and relieve the pressure and the irritation on that nerve has an 80 or 90% success rate at relieving your leg pain. So disc herniations are very common. Most of them get better. If they don't get better, surgery is very beneficial. And most people recover completely and are able to go back to normal activity. It takes 6 to 12 weeks to recover completely from the surgery. And the goal is to return to your normal lifestyle, so back to your normal job, back to your normal recreational activities. About 10% of people can have a recurrence with this. 90% of people don't have a recurrence. So again, we encourage people to try to get back to normal activity after they've had surgery, or even after their pain goes away without surgery. Most people are worried that this is going to come back because this pain is very excruciating. Women describe it as being worse than childbirth, worse than kidney stones. It's one of the most severe pains that you can have. But fortunately, most people get better. But because you're afraid of having it come back again, most people try to curtail their activity. But once your pain goes away, the chances of it coming back are not that great. So the goal is to get back to doing normal activity. So I hope that was educational for you. If you want more information, go to our website, and it has a couple of videos that explain disc herniations and sciatica a bit more.